Education is lacking immensely in this country. And based on where you live geographically, there's a paucity of education opposed to where a patient may be living in a more urban setting where they may have access to maybe what's known as ivory tower, large academic institutions where they're doing research and the focus of their clinical practice is education and educating their patients. That's one extreme. But the reality of most patients in this country is that they are being seen by more generalists, more of a private practice kind of setting, more of a critical access care hospital, maybe in the middle of rural America, where education is really, really lacking. That's another reason why I feel that educating patients via digital means can have such a profound effect, because digital means can touch any patient in any zip code. So the more of us physicians who can get out there to educate patients accurately, they can have access to the same information regardless of where they're going for their mammogram. In terms of topics such as breast density, where it's still very mystifying for a lot of people, frankly, breast density itself is mystifying for certain physicians in medicine. One thing that I do, particularly in my practice in my neck of the woods in Kansas City, Missouri area, is actually go out and meet with my referring providers, with primary care providers. And I will get questions like, I don't even know what breast density is. Is 3D mammography good in a young woman with dense breasts? Questions that, into my mind, I'm thinking, you're a physician, you should know this, but honestly, it's not their area of expertise. And that again brings me to another point too, is that as a patient, if you have that choice, you need to know who's reading your mammogram. You need to know who's interpreting your breast imaging, because having a breast imaging specialist interpret that can make all the difference compared to maybe a general radiologist who reads some mammography, some breast imaging, opposed to somebody such as myself who reads 100% breast imaging, and that's all I do is focus on one anatomical part, the breast, so that if there is a subtle irregularity or something in the breast, I'm more likely to find it. And studies are showing that specialists do tend to exhibit increased cancer detection rates. So it's not just something that I'm making up in thin air. I mean, we are seeing this in the field. There's many layers to this, and that's just another reason why platforms such as Learn, Look, Locate are so important to reaching patients regardless of where they live.